Hi, my name is Katie. I'm an occupational therapist, and I'm also specialized in post-cosmetic recovery. The first few days after having a cosmetic surgery can be a little painful, we can feel a little tender, and we can feel swollen. And so this video is going to review with you a type of breathing called diaphragmatic breathing, otherwise known as belly breathing, to help not only the lymphatic system, but it also increases oxygen in your body, helps lower your blood pressure, and hopefully can let your muscles relax a little bit so you're not having as much pain. So when doing this type of breathing, I highly recommend you practice before surgery so that you can get the technique down properly. And then after surgery, know that it won't feel exactly the same, but you'll get back to it. When we breathe with our diaphragm, it helps massage the lymph nodes in our abdomen. So the diaphragm looks like a little kidney bean, and it's placed in our abdomen. And when we breathe with it, we can push up against our lymph nodes and then relax. The abdomen is sometimes considered the mothership of the lymphatic system because once we get this fluid moving through our abdomen, then our legs can start to drain in our arms. And so this is where we need to start. So you can be sitting in a chair, you can be lying in your bed, on the couch, wherever you feel comfortable after surgery. So you can do this anywhere, but you're gonna place one hand on your tummy and one on your chest. You're going to inhale for a count of 8, but when you inhale, you're going to inhale in through your nose and your belly is going to expand first before your chest. And this allows your diaphragm to move. And a lot of us, we've all trained ourselves not to do this because we try not to pooch out our tummy, but we need to do this for that diaphragm to move. Again, if you're practicing this before surgery, which I highly recommend, you're not going to get the movement that you have after surgery, especially for the first few days. Give it a couple weeks and then you'll get that movement back. But don't be surprised if you're like, I used to be able to take a deep inhale with that belly moving. Give yourself some time to get back there. So one hand on the chest, one hand on the belly. You're going to breathe in through your nose for a count of 8 and your belly is going to move first. So inhale. And then you're going to exhale through your mouth, nice and slow, with your belly sinking down to your spine and moving. Very good. Let's do it again. Inhale in through the nose for a count of 8. 2, 3, 4, 5, 6, 7, 8. Exhale through the mouth. 8, 7, 6, 5, 4, 3, 2, 1. Let's do it again. Inhale in through your nose. 3, 4, 5, 6, 7, 8. Exhale through your mouth. 7, 6, 5, 4, 3, 2, 1. Very good. So after surgery, if you cannot do a full count of 8, start with a count of 4. Slowly build up to it. Be gentle with your body. And just know that as we're doing those inhales and exhales, really kind of try to set in with your body. Let yourself think, okay, relax my muscles, because we tend to carry a lot of stress and tightness up in our upper traps, even though if we had our abdomen worked on. So take your time, be gentle, and practice before your surgery.